All right, let's dive into ascites today. You guys sent in some really interesting stuff about fluid buildup in the abdomen, especially that TikTok video from Ivana.
Oh yeah, that one.
It's pretty wild, actually. She's documenting her whole experience. I gotta say, using TikTok for medical stuff, that's a new one for me.
Yeah.
But hey, it's 2024, right? So we're gonna see what we can learn from her story and then really break down the science behind ascites.
I think it's so interesting how people are using social media to share their health journeys.
Yeah.
And, you always have to be careful about the medical information you find online.
Totally.
But these firsthand accounts can help us understand what patients are going through.
Exactly. So Ivana's video starts in the hospital, and you can tell right away that she's not feeling well. She's lying in bed, has this drainage tube, and she's talking about how distended her stomach is.
It's really powerful to see the impact visually.
Ascites isn't just about fluid. It's about the pressure it puts on your organs. No wonder she's having trouble breathing.
Oh, right.
And she even mentions that the fluid is reaching her lungs, which is pretty scary.
Yeah.
It made me realize this is way more serious than I thought.
Oh, for sure. When it gets to that point, ascites can be life-threatening.
Wow.
Luckily, it usually develops slowly, so doctors have time to step in.
Right.
But her case really shows how important it is to catch it early.
So speaking of catching it early, Ivana mentions feeling bloated and getting full really quickly before things got really bad. I guess those could be red flags.
You're right. Those are actually really common early signs, but people often ignore them. Along with unexplained weight gain, they can be a sign that something's off. It's always best to check with the doctor if you see these, especially if they stick around.
Okay, good advice. Now, the video shows them putting a drainage tube into her abdomen. And I'm not going to lie, it looks pretty intense.
Even though they're using ultrasound to guide it.
It's called a paracentesis. And while it might seem scary, it's a pretty routine procedure.
Really?
Imagine a thin, flexible tube going into the abdomen to drain the fluid. Ultrasound helps make sure they place it right to minimize risk.
That makes sense. Ivana said she wanted general anesthesia, but only got local. And you could tell she was really anxious.
Yeah, I can understand that. It's got to be stressful even with a local anesthetic. But they have to drain it slowly.
Oh, why is that?
To avoid sudden changes in blood pressure, which can be risky. It's all about safety.
And get this, they drain 2 liters of fluid.
2 liters?
Yeah, she even shows a 1-liter bottle on camera so you can really see it. I was shocked.
2 liters is a lot. That's a serious amount of fluid.
It's crazy.
It's a good visual, though, of how much ascites can affect the body. It's interesting. She said the fluid was brownish red.
Oh.
That can actually tell us something about the cause.
Because they don't just, drain the fluid and that's it.
Nope, they analyze it. That fluid can reveal a lot. Brownish red, for example, could mean there's bleeding in the abdomen. Milky fluid might suggest a problem with the lymphatic system. This helps them figure out how to treat the root of the problem, not just the ascites.
So Ivana's video really shows that ascites isn't just about discomfort, right?
Why?
She mentions complications like not peeing enough, a rapid heartbeat, pressure on her organs. She needed specialists from different areas, which is pretty scary.
Yeah, I mean, her experience shows how serious it can be and how many things it can affect. When fluid builds up, it can impact a lot of different systems, so she needed that specialized care. Draining the fluid helps, but you have to fix the underlying cause, too.
And this is where the TikTok comments get interesting. Everyone's throwing out ideas about what caused her ascites. PCOS, alcohol, liver disease, kidney failure. It's a lot. Where do we even begin to sort through all of that?
It's hard, right? The comments show how tricky it can be to figure out medical stuff online.
Yeah.
Some of the ideas might...
So let's use Ivana's experience as a way to learn more about this. What actually causes fluid to build up like this? And how do doctors figure out the root cause?
That's a great question. And that's where diving into the science of ascites helps. There are a bunch of different things that can contribute, and sometimes it's a few things together.
Okay, let's break those down. What are some of the most common causes of ascites? And how does Ivana's PCOS, which she mentions in the video, play into all of this?
Well, PCOS itself doesn't directly cause ascites.
So no direct link there.
Right. But some complications from PCOS, especially those related to fertility treatments, can lead to fluid buildup.
So PCOS isn't equal to ascites, but it's a part of the puzzle to consider.
Exactly.
Especially with everyone online connecting the two. What are some other possible causes we should know about?
Let's get into those next. And then we can talk about how doctors use all the clues to figure out a diagnosis and come up with a good treatment plan. So we were talking about PCOS and how it's not a direct cause of ascites, but some things related to it or its treatment can be involved.
Right.
One of those is something called ovarian hyperstimulation syndrome, or OHS.
OHS.
Yeah. It can happen in women with PCOS who are getting fertility treatments.
Okay.
It basically messes with the hormones, making the ovaries swell up, and that can cause fluid to build up in the abdomen.
So it sounds like PCOS is more of an indirect thing in some cases.
Yeah.
What are some other causes that we should be aware of?
Well, on top of what we've already talked about, ascites can also be caused by infections, like tuberculosis that affect the abdomen, heart failure, liver cirrhosis, kidney failure, even some cancers.
Wow, that's a lot to think about.
It is.
So how do doctors even start narrowing it down in a case like Ivana's?
It's like being a detective. They'll start by, getting all the information about the patient's medical history, their symptoms, their lifestyle.
Right.
A physical exam will help them check things like how much swelling there is, and then they'll order tests.
Like what kind of tests?
Blood work, urine analysis, imaging studies.
I noticed that Ivana mentioned having a CT scan and an X-ray. Are those common for ascites?
Absolutely. Imaging is super important, like CT scans and ultrasounds. They help visualize the fluid, see how bad it is, and rule out other things that it could be. A CT scan gives you a really detailed cross-sectional view of the abdomen.
Oh, wow.
So doctors can pinpoint exactly where the fluid is, how much there is, and check if any organs are involved. X-rays can also show signs of ascites, but they're not as detailed.
So they gather all this information, the history, what they find in the exam, the test results, and then they put it all together.
Yeah, like a puzzle.
To try to figure out what's causing the ascites. What happens next?
Once they know what the underlying cause is, they can come up with a treatment plan that really targets that cause.
Okay.
And remember, treating ascites isn't just about getting rid of the fluid. You have to address the root of the problem to stop it from coming back.
That makes sense. So what are some of the treatments for those underlying causes? I mean, it seems like it could be anything from medication to something much more serious, depending on what they find.
You're exactly right. The treatment totally depends on the cause. For example, if it's because of heart failure, they'll focus on meds to help the heart work better and diuretics to get rid of excess fluid. If it's an infection, they'd use antibiotics or antivirals.
Makes sense. And what about for those more serious conditions like liver cirrhosis? What are the options there?
Liver cirrhosis is a tough one. It usually needs a multi-pronged approach, lifestyle changes, meds to manage complications. And in severe cases, they might even need a liver transplant.
Wow, that's a huge range of possibilities.
It is.
It really shows how complex this whole thing can be and how important it is to get the right diagnosis.
Exactly. That's why it's so crucial to have a good doctor, someone who can walk you through everything, explain the options, and help you make good choices about your care.
Speaking of making choices, Ivana mentions at the end of her video that she doesn't have any dietary restrictions. Is that usually the case with ascites?
That's a really good point. Diet recommendations are definitely going to be different depending on what's causing it.
Okay.
Like, someone with liver cirrhosis might need to limit salt and fluids to help reduce the buildup, whereas someone with a different cause might not have those restrictions.
So it's not a one-size-fits-all kind of thing when it comes to diet.
Nope.
It's all about personalized care.
Exactly. Working with your doctor or a dietitian to figure out the best diet and lifestyle changes for you is key.
So we've talked about causes, diagnosis, treatment. What about prevention? Are there any things people can do to lower their risk of getting ascites?
That's a great question. You can't prevent every cause, but a healthy lifestyle can really make a difference.
Like what kind of things?
Maintaining a healthy weight, eating a balanced diet, regular exercise, limiting alcohol.
The usual suspects.
Yeah. These things are good for your overall health anyway, and they can help protect you from things like liver disease and heart failure, which we know can lead to ascites.
So even if we can't totally eliminate the risk, taking care of ourselves can lower the chances.
Definitely. It's all about being proactive. And this brings us back to social media and its role in all of this. We know that platforms like TikTok shouldn't be our main source of medical info, but they can do a lot of good.
Yeah.
Raising awareness, connecting people with resources, encouraging healthy habits.
I agree. Ivana's video might have sparked some not so accurate theories in the comments, but it got people talking about ascites, sharing their own experiences, and looking for more information.
That's a powerful thing.
It is. It highlights how important it is to be careful about what we read online.
Right. We have to be critical thinkers, check our sources, and talk to real healthcare professionals before making any decisions based on what we see on social media.
So it's about finding that balance.
Exactly. Using social media for good things, like raising awareness and building community, while also being cautious and seeking out accurate information.
What else can we learn from Ivana's experience, especially as we navigate all this new digital health information?
Well, I think her story also shows us how important it is to speak up for ourselves when we're dealing with healthcare. She told them she wanted general anesthesia, and even though she didn't get it, at least they heard her.
Right.
It shows us that we need to be open with our doctors, ask questions, get things clarified, and let them know what we need.
It's about being involved in our own care.
Yes. And if you're ever not sure about something, get a second opinion. It's your health. You have the right to make informed choices.
It sounds like good communication, being involved, and having a good relationship with your doctor are really important.
Absolutely.
Yeah.
Trust, honesty, and making decisions together are key for quality care. And as we're wrapping up, I think it's important to remember that behind all the medical terms and treatments, there are real people going through some tough stuff.
Like Ivana. Her video reminded me that the human side of medicine matters just as much as the science. It's about empathy, understanding, and supporting each other.
That's beautifully put. It reminds us that we're all in this together. Whether we're sharing our stories on social media or talking to our doctors, we can learn from each other and work towards better understanding and care for everyone affected by ascites.
Wow. It's amazing how we started with just a TikTok video and ended up on this deep dive into ascites.
Yeah.
We've gone through the medical side, the diagnosis, the treatments, even talked about the social and emotional parts of it all.
You know, it really shows how powerful storytelling can be, even on social media. It made us look past the initial shock of seeing a medical procedure on TikTok.
Right.
And really dig into the science, the challenges, the human experiences that go along with ascites.
I feel like I have a totally different understanding of ascites now.
Yeah.
At first, I just thought of it as bloating, but it's so much more than that.
It is.
It's complex, and it can really impact your whole health.
It's a good reminder that things aren't always as simple as they seem on the surface.
Right.
When we take the time to understand the causes, the symptoms, the potential complications, we get a much clearer picture of what people with ascites are dealing with.
And that helps us be more understanding and supportive.
Exactly.
So, as we wrap up our deep dive, what do you think is the most important thing for our listener to take away from all of this?
I think it's about feeling empowered.
Okay.
Knowledge is power, right? And understanding ascites the causes, symptoms, treatments. It can help people advocate for themselves, make good decisions about their health, and get the right care.
I totally agree. And I think Ivana's story shows us that even though social media can sometimes spread misinformation, it can also be a really great tool for raising awareness, connecting with others, finding support.
Absolutely.
So it's about being smart about the information we come across, having good discussions, and building a community around these health challenges. So, to our listener, we'll leave you with this final thought. Ivana's experience reminds us that the human side of medicine is just as important as the science. Keep asking questions, keep learning, keep sharing your stories. Your voice matters, and what you've been through can make a real difference in someone else's life.
Don't forget to subscribe and hit the notification bell for future podcast notification. This is the podcast, powered by OnQ New Media.